Good morning and good afternoon, everyone. Welcome to the 30th MedResults Network educational webinar. I'm Jamie Parrott, the COO of MedResults Network, and as always, I want to thank everyone for attending here today. Also keep in mind, if you've missed any of our webinars in the past, we're always recording our webinars so you can access them anytime. You can visit MedResults Network at our website at www.medresultsnetwork.com. We have a whole list of our archive webinars there, and we're continually adding new ones as they become available. We're really excited for our 30th webinar today because we've invited our new partners at Cardinal Health to participate, and they have put together an excellent educational presentation geared specifically towards our surgical practices. For those of you who've been following our announcements, we're super excited that our Cardinal Health contract is probably the best partnership we have for MedResults Network surgeons, as it provides the best ASC pricing in the industry. Through our collaboration with Cardinal Health, our surgeons who have on-site accredited general anesthesia-based ORs, you now have access to aggregated ASC pricing, which provides 0% plus cost markup on, cost plus 0% markup on Cardinal branded products and cost plus 4.5% markup on non-Cardinal branded products. So that's pretty amazing for all of you who do work in the OR. Our aggregated ASC pricing allows you to purchase your OR supplies at the same level or better than your typical multi-operating room, multi-specialty ASCs in your community. And this pricing, as I mentioned before, is probably just about the best you can get anywhere if you're not in a hospital or huge surgery center setting. And the best part about this is that this pricing is not limited to only our members with accredited on-site ORs, but our members who use custom surgery packs and choose to do their cases in community ASC can also benefit. The reason I'm also so excited about this partnership in our webinar today is that aside from the deep discounts and all the great things like price transparency that Cardinal offers, they also provide free clinical assessments, which is really the basis of our webinar today. Cardinal Health is unique in that they have a team of experienced perioperative nurses that help surgery centers assess the clinical effectiveness of existing procedure pack program utilization, also utilization of supplies in the OR, and also the management of your inventory in an ASC or OR setting. And all of Cardinal's clinical assessment team members are registered nurses, like our presenter today, and they have an average of 20 years of OR and supply chain management experience. So we are thrilled to introduce to you our presenter, Deb Miller. She is here with us today to share some extremely useful tips on how to increase efficiencies and reduce costs and overall waste in your on-site OR or surgery center. And as a senior consultant of the clinical operations for Cardinal Health ASC, Deb frequently visits surgery practices to help them identify areas of improvement, including the ones I just described. And today she'll also explain her clinical assessment process, which is generally offered at no cost to Cardinal customers. So with all that said, one more thing before we begin our presentation, I just want to remind you that as always, we have a 30-second survey that'll pop up at the end of the presentation. This is how we determine the types of presentations we're going to be doing in the future, what type of education you want, and what you really want to learn about from MedResults and our partners. So please take a second to fill this out after the end of the presentation. We really appreciate your feedback. It helps us to make our content more valuable for you guys. If you have questions for Deb or you're interested in having a rep visit with you to determine your cost savings through Cardinal Health, you can use the survey to contact us. So with that said, I would like to introduce to you Deb Miller, the Senior Consultant of Clinical Operations for Cardinal Health.
Good morning, everyone. Like Jamie said, I've been with Cardinal Health about 11 and a half years. So after this presentation, you know, you should be better prepared to look at some of our objectives with a different viewpoint and see what best we can do for you as a Cardinal Health company. So in the next few minutes, we're going to discuss specific strategies that can help you manage your ASC's operating room inventory more effectively. And that's especially important right now as ASCs, just like yours, are challenged like never before to lower costs while maintaining patient throughput and quality of care. After the presentation, you should be better prepared to discuss why supply management in your operating room is important, describe the challenges of effective OR supply management, review the current processes, including clinical practices used to manage OR supplies, outline strategies to improve OR inventory management, and in particular, we'll discuss how you can uncover hidden waste and discover areas of real savings. And we'll review how best practices from ASCs across the country can be customized to meet your ASC's own unique challenges. And last, review the roles and responsibilities of perioperative nurses in effectively managing OR supplies. So let's get started by sharing why Cardinal Health is uniquely qualified to help your ASC improve processes, lower costs, support patient safety initiatives, and streamline inventory management. The next slide, please. With more than 40 years of experience, Cardinal Health is a recognized leader in transforming the healthcare supply chain to meet new challenges around cost, revenues, and outcomes. In particular, Cardinal Health is the leading med-surg distributor for the ASC market. Our clinical team of perioperative nurses averages 20 years of OR and supply chain management experience. So we're here to help you cut waste and OR costs both now and into the future. And a prime target for savings is your supply spend. So let's take a look at the numbers. Next slide. For each surgical suite, the average ASC spends $230,000 on supplies and keeps between $100,000 and $120,000 of inventory on hand. The average inventory turn is just 4.8 times annually. As a percentage of net revenue, ASC supply costs are substantial, ranging between 17 and 25%. And supply management takes a toll on ASC staff as well. 25% of clinical staff time can be spent on supply chain activities. While supply cost pressures are a concern, so too is the average ASC's overall financial health, and that's due to a number of factors. We'll go to the next slide. Several financial pressures are impacting ASCs today. For starters, ASCs are paid nearly 50% less for the same service as hospital outpatient departments. At the same time, ASC profits are declining as reimbursements fall. And the broader financial impact is as yet unknown. How will the shift in reimbursement guidelines from fee-for-service to value-based care ultimately impact ASCs? While the financial pressures loom large for ASCs, so does the opportunity. The fact is that patients often prefer ASCs over hospitals, which can be overwhelming and hard to navigate. In contrast, ASCs can be more convenient, have better service, and feature lower out-of-pocket cost. To keep service levels high and costs low, ASCs need new ways to cut waste and lower cost. And focusing on OR supply management is a prime opportunity. Next slide. So where are the supplies? To uncover the waste, we first have to recognize that supplies are duplicated in many areas. In fact, the same supplies can be found in the surgical suite, OR core area, on specialty carts, in case pick areas, case carts, bulk storage, and other non-official areas such as the nurses' lockers. And if you're an OR nurse, you know what I'm talking about. 7+ locations where you can find exactly the same product. Multiply this number by inventory dollars per operating room and the financial impact becomes overwhelming. To cut this waste, ASCs need a new approach to managing OR inventory, but there are several challenges to overcome. So let's take a closer look at that. Next slide. Managing OR inventory is no small undertaking. Some of the major challenges include the diversity of procedures, physician preferences, typical practice issues, limited data, preference card management or lack of preference cards altogether, duplication of supplies like we just discussed, the lack of automated inventory control systems, and having multiple categories of OR supplies. So let's dig deeper into the first challenge, the diversity of procedures. Next slide. Every day across the U.S., there are thousands of procedures performed, and each one requires a variety of supplies. There is little, if any, consistency in what is used. For example, the cost for supplies for a simple laparoscopic procedure can vary by hundreds of dollars. While different procedures require different supplies, many basic supplies are required for all surgical procedures. However, few, if any, operating rooms have been willing to eliminate any supplies in fear of not having something that the surgeon might request. In addition, past practice was more is better. Rarely would anyone run out of supplies in the OR because historically the practice has been having it just in case, which is placing one on the shelf and one in the drawer, just in case it's needed. Imagine the waste that just-in-case purchasing creates. Now let's move on to physician preference items. Next slide. A study has shown that surgeons seek 4 things from hospitals: quality, efficiency, input, and appreciation. Responding to physician preference requests demonstrates to surgeons that the facility values them, and it respects their time, cares about their patients, and wants them to have a positive, efficient environment in which to work. This supports the case that surgeon preferences do need to be considered when you're seeking to understand the standardized products. At the same time, many products used in the OR can be clinically equivalent and could be standardized. This is escalated in ASCs due to competition. An ASC's business development function often promises anything to get a physician on board without discussing costs associated with physician preferences. This is a disconnect that should be addressed with both business development and the materials managers and administrators. And it's a perfect example of why it's important to escalate the level of qualities and requirements of potential materials managers when hiring for this position in an ASC. Now let's take a look at typical practice issues that are a barrier to effective inventory management. Slide 11. Effective inventory management in the operating room has been, at best, marginal, and standing in the way are such issues as a lack of data to support inventory levels, the perioperative nurse that opens everything on the preference card to ensure that the surgeon has what he or she wants, people who do not know the operating room do the purchasing and distribution. There is a lack of integration between materials management and surgical services. Few ORs have established PAR levels, and perioperative nurses are not inventory management specialists. In addition, the perioperative nurse is focused on patient care, not inventory management. And the materials manager, who is trying to drive cost savings and manage the inventory, is often not valued by the clinical team. Plus, materials managers may be required to function as clinical staff on a frequent basis, giving them less time to manage the inventory properly that they were hired for. Now let's discuss the challenge of data analysis. Next slide. There are several gaps in data analysis that ASCs need to overcome. For example, there's a lack of quantifiable data regarding supply usage, inventory levels, product duplication, and procedure costs by physician. Each of these issues has been a barrier to implementing processes that improve OR inventory management. Plus, the method of collecting data is still manual in many ASC ORs, so this lack of technology is hindering the ability to accurately determine where you are regarding annual spend, inventory, and turns. As a result, it's more difficult to set the realistic goals that you prefer. As an example, let's focus on a critical component of inventory management that would benefit from more robust data analysis. This is preference cards, or the lack of preference cards. Next slide, please. Physician preference cards have been the guiding light for perioperative nurses for more than 25 years. The challenge is that ASC clinicians continue to use handwritten recipe cards that don't give materials managers the data needed to evaluate supply consumption. Without the visibility that data analytics can provide, sometimes it's difficult, if not impossible, to align inventory levels with actual product usage. As a result, purchasing is driven by just-in-case or just-in-case practices. And there are more examples of supply waste in the OR as well. Next slide. Product duplication is another major contributor to waste and a significant barrier to managing OR inventory more effectively. There is not a day that goes by without some new and better product being introduced in the operating room. Rarely, if ever, is there clinical evidence to provide this new widget improves patient outcomes. To sum it up, product duplication drives supply cost up in the operating room. For example, just think of all the glove types from all the glove vendors that you probably have in your OR right now. Ask yourself, are there some duplicates you could eliminate without impacting the patient care? That begs the broader question, what can you do right now to take greater control of your OR inventory? Next slide. There are several opportunities to take greater control of OR inventory, including product consignment, product standardization, improved acquisition and distribution processes, and instituting a process to control new product flow and vendor access. So what's the first step in putting these opportunities into action at your ASC? Next. Improving your OR inventory management starts by bringing all of the right people to the table. Organize a supply chain team that includes hospital leadership, materials managers, physicians, and perioperative clinical staff. It's critical to educate stakeholders, accessing and presenting the facts as the first step in addressing the problem. Those facts include actual cost incurred of supplies, the cost of product duplication, variation in procedure cost, and cost of excess inventory. Depending on the stakeholders, the impact of this information will vary. For nurses, it's the realization of knowing what supplies actually cost. For physicians, benchmarking the cost of their procedures gets their attention. And in an ASC, that is a definite impact on distribution checks and profit sharing. So the next step to educate your ASC stakeholders is just as critical. Next slide. Have your entire supply chain team do a walkthrough of your OR operations with these points in mind. Visit all the stocking locations. Look for duplications and excess inventory. Also look for mission bins. Mission bins typically are supplies that get left over. Frequently, ASCs have physicians to third world, and they kind of save things and supplies so that they have them when they travel. Observe the case pick process, review pick lists for accuracy and have availables, evaluate daily returns from the OR, and review group observations. Once the stakeholders see your inventory issues firsthand, you'll be in a better position to gain the support you need to solve them. Once you've had that buy-in, what strategies can you use to begin improving OR inventory management right away? Next slide. An initial step is to consolidate like products. The most painless and effective way is to select non-physician commodity products first. Most operating rooms have an excess of like commodity products, such as masks, surgeon's gloves. Consolidating these commodities can be as simple as standardizing from 3 glove vendors to 1. Another way is to reduce the number of OR locations where individual products are stored. You can also combine individually pulled products into procedure-specific kits or packs, either standard or custom configured, and then work with vendors to develop appropriate kits for high-volume, supply-intense procedures, and base kits on actual volumes and group similar draping practices. Also, be sure to review content quarterly for item changes, waste elimination, and practice changes. Add towel, for example. As part of the review process, include preference cards, case carts, and return carts. And this is what the basis of our clinical assessments are. We come in and review these things with you. And as you know, surgeons come and go, practices change, so periodically the packs or your supplies need to be reviewed. There are additional strategies for improving inventory management as well, such as looking for consignment opportunities. Next slide. Work with vendors to identify consignment opportunities for high-cost products, such as orthopedic and spine implants and instrumentation. While you do this, be mindful of the challenges with consignment, which include keeping an accurate count of what products are placed in the facility, encouraging vendors to keep consigned products to a minimum, and managing expiration dates. And if you do total joints in your ASC, you know that consignment is very beneficial because you can't afford to keep all of the total joint implants on your shelf from year to year without having them consigned by your rep. Now let's move on to product standardization. Next slide. 34% of ASCs use product standardization as a supply chain strategy, but it can be a powerful tool to cut waste and lower cost. ASCs need leadership to drive this cultural change and stand firm in every decision to standardize. And the best place to start is commodity products that have little or no clinical sensitivity. As you implement your standardization strategy, work on reducing multiple and duplicate SKUs. Require clinically acceptable alternatives. Look for opportunities inside and outside of kits. To gain buy-in among clinicians, involve vendors and sales specialists in product trials or sampling. And focus on such products as drapes and gowns, implants, and sutures. One of the main roadblocks to standardization is variation in equipment. The disposable costs associated with any capital purchase should be taken into consideration before that purchase. So the next strategy for better inventory management is controlling the flow of new products and vendors into your ASCs. Next slide. An unrestricted flow of new products and vendor access can result in tremendous waste and needless cost. To turn this trend around, the first step is to establish and enforce a policy and procedure on new product entry. The second step is to establish a multidisciplinary committee to oversee requests for new products. Third, to control vendor entry and access to your staff. That way, you can avoid the introduction of trunk products into your OR. Now that we've covered several strategies for helping you gain greater control over your inventory, what else can you do to reduce waste and costs while improving efficiency into the OR? Next slide. We recommend expanding the scope of your action plan to include critical clinical practice issues, such as eliminating waste, over-draping, choosing the right product for the right task, selecting the right level of protection for each case, eliminating practices that do not add value or improve outcomes, and converting to clinically acceptable product alternatives. To sum it all up, we've discussed why focusing on OR inventory management is important and how improving it can increase efficiency, cut waste, and lower costs. We've also shared several strategies that you can use to improve your OR inventory. This includes not only focusing on traditional supply chain activities, but also clinical practices. So, after all of this, how do you put your own plan into action? Next slide. Take these 7 steps. Establish a baseline of what you're trying to accomplish. Set specific and measurable goals to help you get there. Assemble a team of stakeholders. Determine the appropriate solutions to implement. Develop an action plan to implement them. Operationalize your plan. And then measure your success. So that's a brief overview of what we can do for you at Cardinal. Are there any questions or comments?
Thank you, Deb. No, at the moment I'm going to leave it open in our survey for our attendees to actually reach out to you directly, Deb. And like I said before, there's a question on the survey for everyone that fills it out, asking if you'd like more information from Deb, or if you'd like a Cardinal rep to actually come out and visit with your practice. So be sure to fill that out in just a moment. And I failed to mention Deb travels all over the U.S. and she meets with many different surgery centers and physicians, and so she's in a different part of the country right now, which is why we were separately going through the slides. But so you guys can have access to that presentation as well. If you want to review some of the information that Deb went over today, there is a handout attached. You'll probably see it in the little pop-up webinar window, should be on the right of your screen. Access that presentation by downloading it here, or if you'd like to just simply let us know to email it to you, we can also do that as well. So once again, Deb, I want to thank you again for presenting today. We enjoyed your content, and if anybody has questions, we would love to hear from you. Thank you again for attending, and we'll see you at the next webinar. Bye-bye.
Okay, thank you very much, everyone.
Thanks, Deb.
Thanks, Jamie.